Have you noticed something strange happening every morning? You wake up, you take your first sip of water, you swallow, and there it is again. That uncomfortable feeling at the back of your throat, a thick coating, a lump-like sensation, a feeling that something is stuck there. So you clear your throat, then you clear it again, and again. Maybe you have been doing this for months, maybe even years. You carry water with you everywhere. You keep cough drops nearby. You have tried honey, warm drinks, home remedies. Maybe someone even told you, that is just part of getting older. But what if that is not the full story? What if your body is not simply aging? What if it is trying to tell you something specific? I am Dr. Daniel Brooks, and today we are going to talk about why so many adults over 60 experience constant mucus in the throat, frequent throat clearing, and that uncomfortable feeling that never completely goes away. And more importantly, we are going to discuss 5 common causes that may be behind it. Some of these causes are connected to your stomach. Some are connected to your nose and sinuses. Some may be related to medications you have been taking for years, and some are connected to changes that naturally happen in the body as we age. But before we begin, I want you to remember something important. Mucus itself is not the enemy. Your body is supposed to make mucus. In fact, mucus is one of the reasons your respiratory system stays protected. It traps dust, it catches bacteria. It helps prevent viruses and irritants from reaching deeper into your lungs. Without mucus, your throat and airways would become dry, irritated, and vulnerable. The problem is not having mucus. The problem is when mucus becomes too thick, excessive, or difficult to clear. And after 60, several changes can make this happen more easily. Your body does not clear mucus the same way it did when you were younger. The natural cleaning system inside your airways becomes slower. The tissues become more sensitive. Certain medications become more common. Sleep changes, digestion changes, and small problems that your younger body handled quietly may become much more noticeable. Before we talk about the causes, take a moment and think about your own symptoms. When is your throat mucus worst? Is it first thing in the morning, after eating, when lying down, after drinking coffee, or does it stay with you all day? That timing can provide important clues. Because your symptoms are not random, your body is giving you information. Now let us start with the first cause. Cause number 5. Your body is producing thicker mucus. As you age, many people are surprised when they learn this. Your body has a natural mucus clearing system. Inside your airways are millions of tiny hair-like structures called cilia. Their job is simple. They move mucus upward and help remove trapped particles. Think of them like tiny brushes cleaning the inside of your breathing passages. When you are younger, this system works efficiently. Mucus is produced, it moves, you swallow it without even noticing. But as we age, this process can become slower. The cilia may not move as quickly. The mucus may become thicker, and instead of quietly moving away, it can begin collecting at the back of your throat. This is why some older adults say, "I feel like I always have something stuck there." The feeling is real. Your body is not imagining it. But there is something important to understand. Age itself is usually not the only cause. Aging simply makes the body less able to compensate. Then, other factors can push the problem further. For example, not drinking enough water, dry indoor air, certain medications, sinus irritation, reflux. All of these can make mucus thicker and harder to clear. This is why simply accepting it as normal aging may prevent you from finding the real cause. Now let us move to the first major cause that many people completely miss. Cause number 4. Silent acid reflux. Most people know about acid reflux. They imagine heartburn, a burning feeling in the chest, a sour taste in the mouth, discomfort after a heavy meal. But there is another type of reflux that many older adults experience without realizing it. It is called silent reflux. The medical term is laryngopharyngeal reflux, and it behaves differently. You may not feel burning. You may not have obvious stomach symptoms. Instead, the acid quietly travels upward and irritates your throat. Here is what happens. Between your stomach and your esophagus is a muscle that works like a doorway. Its job is to open when food goes down and close afterward. But as we age, that muscle may become weaker. When it does not close tightly, small amounts of stomach contents can move upward. Sometimes they reach the throat and voice box. And your throat is not designed to handle stomach acid. Even small amounts can trigger irritation. Your body responds by producing extra mucus as protection. That mucus is your body's attempt to defend sensitive tissue. This is why some people wake up every morning with a thick throat, a need to clear their voice, a rough morning voice, or a feeling that something is stuck. And many people never connect it to reflux because they never experience heartburn. They think, my stomach is fine. But the problem may not be the stomach. It may be what reaches the throat. Now ask yourself, do you wake up with more mucus than you had before going to bed? Does your voice sound different in the morning? Do you clear your throat more after lying down? Do symptoms become worse after late-night meals? If yes, silent reflux may deserve attention. Some simple habits can help. Avoid eating large meals close to bedtime. Try finishing dinner several hours before lying down. Be careful with foods that commonly trigger reflux symptoms, such as very spicy foods, large fatty meals, chocolate, alcohol, or acidic foods if you notice a pattern. And consider slightly elevating the head of your bed if nighttime symptoms are common. Not with extra pillows that bend your neck. A proper incline works better. But remember, persistent symptoms should still be discussed with your healthcare provider, because throat mucus can have multiple causes. Now, before we continue, subscribe to the channel if you want practical senior health information that explains common symptoms in a simple way. Many older adults are told to ignore changes in their body, but understanding those signals can help you make better decisions. Now let us move to another common cause. Cause number 3, post-nasal drip from sinus problems. When people think about sinus problems, they often imagine severe symptoms. A blocked nose, facial pressure, a painful sinus infection. But many older adults experience a much quieter version. The nose and sinuses may produce extra mucus that slowly drains down the back of the throat. This is called post-nasal drip, and it can happen even when your nose feels mostly normal. You may breathe fine. You may not have pain. You may not think your sinuses are involved. But the mucus continues moving backward, and that constant drainage irritates the throat. The result? Frequent throat clearing, a cough that is worse at certain times, a feeling of mucus sitting behind the tongue. Several things can contribute: allergies, dry air, environmental irritants, changes in the nasal passages, chronic inflammation. And as we age, the tissues inside the nose can become more sensitive. One mistake many people make is relying only on drying medications. They think, if I dry the mucus, the problem disappears. But sometimes overly drying mucus makes it thicker, and thick mucus can actually feel worse. One approach often recommended by ear, nose, and throat specialists is saline nasal rinsing. A gentle saline rinse can help remove irritants. It can thin mucus, and it can support the natural cleaning process inside your nose. If you use a nasal rinse, make sure you use safe water. Use distilled water or previously boiled and cooled water. Do not use unsafe tap water. And if you have certain medical conditions or concerns, ask your healthcare provider first. Consistency matters. One use may provide temporary relief, but regular use is what often makes the difference. Now, if you are still watching and this information is helping you understand what may be happening in your body, stay with me, because the next causes are often overlooked, and one of them involves something many seniors take every single day. Now let us continue with a cause that surprises many older adults. Because when people think about constant mucus in the throat, they usually think about allergies, cold weather, or sinus problems. But sometimes the cause is something sitting inside your medicine cabinet. Cause number 2, certain blood pressure medications. Millions of older adults take blood pressure medications every day. And these medications are often extremely important. They protect the heart. They reduce the risk of stroke. They help control dangerous blood pressure levels. So I want to make something clear. Do not stop any medication on your own. But it is important to understand that some medications can create side effects that people never connect to the medicine. One example is a group of blood pressure medications called ACE inhibitors. These medications work by affecting a system involved in blood pressure regulation. They are commonly prescribed because they are effective. But for some people, they can cause a persistent throat irritation. The symptom is often described as a dry cough, a constant urge to clear the throat, a tickling sensation, or the feeling that mucus is stuck even when there is not much mucus present. This happens because these medications can increase a substance called bradykinin. In some people, this can irritate the airway and create a chronic cough or throat-clearing sensation. One reason this connection is missed is timing. Many people assume, I started this medication months ago. How could it be causing a problem now? But medication side effects do not always appear immediately. Sometimes they develop slowly. You may begin a medication. Months later, your throat symptoms appear, and you never connect the two events. This is why reviewing your medication list is so important, especially if your throat symptoms started after a new medication, your cough appeared without a clear infection, you have already tried treating allergies or reflux without improvement. If this sounds familiar, talk with your doctor. Your doctor may decide whether the medication is the likely cause and whether another option is appropriate. Another category of blood pressure medication may work differently and may not create the same throat-related side effects. But again, this is a conversation for you and your healthcare provider. Never stop blood pressure medication suddenly without medical guidance. Your blood pressure is protecting your body every single day. Now let us move to another cause that seems simple but is often underestimated. Cause number 1, dehydration. Many older adults are walking around mildly dehydrated without realizing it. And this can directly affect your mucus. Think about the difference between fresh honey and honey that has been left open. Fresh honey flows easily. Older, dried-out honey becomes thick and sticky. Mucus behaves in a similar way. Your mucus is mostly water. When your body has enough fluid, mucus stays thinner and moves more easily. When your body is dehydrated, mucus can become thicker. It becomes harder to clear. It sticks more easily to the back of your throat. And you may feel like you constantly need to swallow or clear your throat. Now here is the important part. As we age, thirst signals often become weaker. A younger person may feel thirsty quickly when the body needs water, but older adults may not receive that same strong signal. You may not feel thirsty even when your body would benefit from more fluid. This is why many seniors accidentally drink less than they need. They wait until they feel thirsty. But by then, dehydration may already be affecting the body. Signs that you may not be getting enough fluids can include dry mouth, dark urine, fatigue, dizziness, constipation, and thicker mucus. The solution is not to suddenly drink huge amounts of water, especially if your doctor has placed you on fluid restrictions because of heart failure, kidney disease, or another condition. Instead, focus on consistency, small amounts throughout the day. Keep water nearby. Drink with meals. Include water-rich foods, soups, fruits, vegetables, herbal teas. These all contribute to your daily fluid intake. A simple morning habit can also help. Before reaching for coffee, consider drinking a glass of water first. After several hours of sleep, your body has gone without fluids. Replacing that lost fluid can help your throat feel more comfortable. Now we need to talk about one final cause, and this one is not discussed enough, because many people never think their throat symptoms could be connected to their digestive system. Another important factor, your gut health. Your throat and your digestive system may seem completely separate, but your body does not work as isolated parts. The gut and the respiratory system communicate through your immune system. Researchers call this connection the gut-lung axis. Your digestive system contains trillions of bacteria. This community is called the gut microbiome. When the balance of these bacteria changes, it can influence inflammation throughout the body. Several things can affect gut balance: a diet low in fiber, too much processed food, high sugar intake, repeated antibiotic use, chronic stress, poor sleep. These factors may influence how your immune system responds, and in some people, increased inflammation can contribute to airway sensitivity and mucus production. This does not mean your throat mucus is always caused by your gut, but it means your overall health habits matter. Supporting your gut health can be part of a bigger strategy. Simple steps include eating more fiber-rich foods, vegetables, beans, lentils, whole grains, adding fermented foods if they fit your diet, plain yogurt with live cultures, kefir, fermented vegetables, and reducing the amount of highly processed foods you eat regularly. This is not an overnight solution. The gut microbiome changes gradually, but long-term habits create long-term improvements. Before we move to the practical steps, I want to talk about something important. Most cases of persistent throat mucus are not dangerous. They are often related to manageable issues like reflux, sinus drainage, medications, or hydration. But sometimes, your body uses symptoms to tell you something needs medical attention. Please speak with your doctor if you notice blood in your mucus, unexplained weight loss, a lump or swelling in your neck, progressively worsening trouble swallowing, a major voice change that does not improve, persistent symptoms that continue despite reasonable changes. Do not ignore warning signs. Your symptoms deserve attention. Now, let us put everything together. If your throat mucus is worse in the morning, think about reflux. If it feels like drainage from above, think about sinus issues. If it started after a medication change, review your medicines. If mucus feels thick and sticky all day, hydration may be part of the problem. If your overall health habits have changed, your gut and inflammation may also play a role. The goal is not to guess. The goal is to look for patterns, because patterns reveal causes, and causes lead to solutions. In the next part, I will share a simple action plan you can start using to reduce throat mucus naturally, including what to change tonight, what to do in the morning, and which common remedies may actually make the problem worse. Now let us put everything into a simple action plan. If you constantly feel mucus stuck in your throat, start by looking at the pattern. If it is worse in the morning, consider whether nighttime reflux may be playing a role. Avoid eating large meals close to bedtime. If your mucus feels thick and sticky, make sure you are drinking enough fluids throughout the day. If you have nasal drainage, discuss sinus care options with your healthcare provider. If your symptoms started after a medication change, review your medicines with your doctor. Do not stop medications on your own. And remember, small daily habits matter. Drink enough water, eat a balanced diet, get enough sleep, stay active, manage reflux triggers. Protect your overall health. Most throat mucus problems are not dangerous, but your body is always giving you information. Do not simply accept uncomfortable symptoms as just getting older. Listen to your body, look for patterns, and ask the right questions. I am Dr. Daniel Brooks, and if you found this information helpful, subscribe to the channel for more practical senior health videos about understanding your body and protecting your independence. Getting older is a natural part of life, but feeling worse every year does not have to be accepted without answers. Small changes can make a big difference. Take care of your body today so it can continue taking care of you tomorrow. Everything shared here is for general education only and does not replace personal medical advice. Always speak with your healthcare provider about persistent symptoms or changes in your health.